would like to acknowledge that this seminar is being held on the traditional lands of the Gubbi Gubbi people, who we pay our respects to the elders past, present and emerging. Now, finally, I want to welcome everyone to the 9th Pacific Seminar Series with the Australian Centre for Pacific Islands Research. My name is Bridget Horsey and I'm going to be hosting the seminar for you today. Today we are really fortunate to have in person Inez Fainga'a Manu-Sione. She's going to be presenting for us. So a warm welcome to Inez, who's sitting beside me here. Inez is a Doctorate of Education candidate at Griffith University. She is a Yolngu.
That would do.
Okay. Fijian and Tongan heritage and married to Samoan chief Toliafua Bruce Māori. I didn't even check that one now, I realised. She also works as a success coach, head of department at Ipswich High School, and is an associate pastor at Hosanna Logan City. Now, the title of her presentation today is Big is Beautiful, Skinny is Sick, and this is Generational Health Perspectives of Māori and Pacific Island Communities in South East Queensland. So her presentation that she'll share with us today, she'll share some preliminary findings from her research that explore the cultural, family and social factors influencing the health choices of Māori and Pacific Island families living in South East Queensland in Australia. I'm going to let Inez start talking.
Thank you so much for welcoming me into your space. God help you all now. I want to start first in a culturally familiar way for Pacific and definitely in Tongan, Fiji and Samoan spaces, and that will be through prayer, lotu. Whenever we gather in the Pacific way, whether it's formal or informal, we always start with God. So I'm going to follow protocol culturally, and if you can join me, we'll bow our heads in prayer. God, I just want to thank you so much for the amazing company of people that have gathered, for the phenomenal work they are doing in the Pacific realm and in this space. And we are excited to gather to share our wisdom, knowledge and understanding so that we can continue to weave a whala of knowledge for our people and our communities. And so I pray that you bless our time today and that we'll be able to have talanoa, unconcealed, unfiltered conversations, the courageous ones that allow us to gain understanding. In your precious and mighty name, amen. Thank you so much. All right, I want to also start with my cultural acknowledgements. The Gubbi Gubbi and the Bachelor people. I want to acknowledge the traditional landowners that we're meeting on. The Australian Centre for Pacific Island Research, thank you for all that you do. I literally was quickly Googling you today. I'm like, I don't even know these people, but I'm excited. Yes, exactly. I'm excited to be a part of the community here today. And Professor Stephen Underhill, thank you for inviting me into the space. I think we met several years ago when I carried on, and so thanks for enjoying that and opening up the opportunity. Also to Bridget Horsey, great work, mate. You've done a wonderful job, and I really appreciate you sending me many emails, and so thank you. I love that. I over-communicate. I'm an islander. We talk about everything. Dr. Inez Mahoney, thank you for engaging in and your beautiful map. Without you, I wouldn't be here today, and Dr. Linda Wes. So these ladies, I've kind of had some kind of connection getting me into this space, and I really appreciate all of it. Plus everyone here that's joining us, all the people online, it's great to have you in this space. And if there's any issues, please don't tell me, because I'll probably disengage you. I'm not technically savvy. So someone will help you, just put it in the chat. Okay, I'm going to open up with my talanoa, a very culturally appropriate way to start. How did I get involved in this, this research work? Well, let me just perhaps give you some context. I actually never realised that there were health issues in my community because of this prevalent perception that I definitely, as you can see, grew up knowing that big is beautiful, skinny is sick. My grandmother overfed me. I didn't know it was overfeeding at that time. I just enjoyed and embraced that love through food. and also the perception that like when you're skinny, you're actually sick and your family can't afford to keep you. So like I said, I didn't, and it wasn't until I started as the multicultural coordinator on the statewide project called Good Start, which was funded by the federal government to improve the health of Māori and Pacific Island communities, that I realised I was sitting in a space of development on this project and realised there were issues in my community in terms of health. I actually had no idea. I didn't even have an idea that there were 5 food groups. And I'm not even kidding, because my friends were like, how can you not know there's 5 food groups? I'm like, well, I studied law, I studied theatre, I studied teaching. I didn't study food. And in my community, what I knew about food was abundance. So it was that PD that made me realise there's actually 5 food groups, and it's not KFC, taro, chop suey bread and corned beef. So that was a very devastating, traumatising moment. Culturally, in my Tongan background, I'm the queen of my family, so it's a matriarchal culture. So everything about my upbringing reinforced my status as a queen, as a hashtag boss. I'm like one girl and 2 boys. So who runs the world? In my world, it's me. So everything about the cultural hierarchy reinforced this culture and of abundant eating and love. So I never knew the severity. I've already said that. I actually never knew that diabetes too was preventable either. I had lots of, and my mum has diabetes, I'm pre-diabetic. My uncle's had his leg chopped off. We've had people die early, and we've just been like, oh, we've lost another one, we've lost another one. But there was never a realisation that these particular issues were preventable. I think that's the thing that was also traumatising, not only that KFC is not part of the food group, but also that I perhaps didn't need to lose my family members. So that was a bit like, my goodness, no one told me. I've spent forever in institutions learning, but no one told me didn't give me this kind of learning that I needed to understand and the impacts of that. So I began this research project while I was at Queensland Health. I think my dilemma at the time was being the coordinator, and you're in charge of a Pacific group of staff that are going out to work in the communities, but it was very much from like Western framework, and I just knew that, mate, that's not going to work because of our cultural understandings and our cultural perception. So that's why I started the doctoral studies, particularly looking at the impacts of Pacific Island culture on our health. Because even though we were going out into communities and teaching them the 5 food groups in a taro leaf, so it was still modified in whatever way, but we weren't hitting the Goliath mammoth issue, which is how do we influence culture to change and begin to really address our ways of relating to food? If we're not going to touch the culture, it's never going to change. And as the research shows, it's not, after the 30, 40 years, it's actually still prevalent. We're still the biggest in the world, in Tonga, in the Pacific nations, in Australia, New Zealand, America. Nothing is changing, despite many interventions. So that tells me if you're not hitting the culture, you're not hitting it. So that's why I started the research work. And this is my research question. What are the cultural, family and social factors that influence our choices in Māori and Pacific Island families in South East Queensland, but I'm sure we can relate it across once we understand. I used constructivist grounded theory and Talanoa as my methodology. I really wanted to use Talanoa as the methodology at the time, but I struggled, and it's known as a methodology, but I struggled trying to understand the analysis process. How am I going to analyse the data when it comes in? And I found that constructivist grounded theory gave me that opportunity of some clear steps to be able to analyse data. And then not only that, create a theory and then a model. So that's what I'm working on now. I started with our elders. We understand the cultural hierarchy. Even though at the time my focus was on teenagers, I knew I couldn't really make an impact if I didn't include the hierarchy. So the cultural, and especially when you want to talk about culture, the elders are the gatekeepers of the culture, and they will reinforce it, and it will continue through. So I joined discussions with the elders first, and that just really opened up a whole, like, I've spent 40 years and there's 46 years in Australia. I was born in Fiji, and I always radically obeyed our cultural protocols and expectations of abundant eating. It was such a struggle. But I never fully understood, you know, the whys and where did it come from our ancestors. I got that knowledge from the elders, and it was profound. And then I interviewed the mothers group, mothers in a Talanoa session, the fathers, the young boys and the young girls. So I will share a little bit of my findings. So the biggest thing I was awakened to when I sat with my elders was just how offensive the term health was to them. And that was an eye-opener for me. I kind of refer myself like I'm a plastic islander. I radically obey the cultural protocols, but I don't fully comprehend. And when I sat with the elders, that was the biggest, like this term health is offensive. My elders were just, it was like an affront of criticism. That's a white man term, and that is critical of my size. And that's not part of my culture. Big is beautiful. So we reject your term and we reject your practices. That was profound. So this, I just want to read this particular, so this was my first meeting with my Māori elder, and we ate for hours, and it was funny, but it was so profound. And so every time, this is her comment, we never talked about health. We never thought of health. Health is a European concept. The European way of thinking is clinical. It's a clinical assessment, but it's not on the state of the spirit of a person. Health is about the mechanical function and perfection of the body. That is the European concept of health. And in that time, every time I'd say the word, she would just go, it's not how, like, that's not us. So I'd have to be like, okay, so what do I call it? What's the term? And she would always refer to a cultural term, wairua, which means the spirit man, the spirit, like, that's what it, when we talk wellness, we talk about wairua, the spirit of the person. So I had to like remember wairua, not health. The most important thing was our connection to the people and to the land. It's about a sense of belonging. And so even the whole thing of food in abundance is our reinforcement of this sense of belonging and connection. When you're born a spiritual being, okay? But Europeans don't know what a spiritual being is. We talked about aura, the life force. If your life force was strong, your spirit being would be strong and in balance with all things. It's about balance when everything is in perfect attune. So it's like, okay. It doesn't look like things are balanced here in my space, but okay, I'm going to own balance. That began a real journey of trying to understand wellness from a Pacific lens, even though I'm fully Pacific and I don't. So these are some of the things that we found. The Western approach to health is secular. First and foremost with the Māori and Pacific, especially from the elders and the parents and the young people, is spiritual first and foremost. Western approach, it's about your body and mind. The Māori and Pacific approach, it's about your character. You're fun, you're loving, and you're happy-spirited. Size doesn't matter until you're skinny. And then they start stressing out, like, what is wrong with your child? It's got cancer, it's too sick. So the character of a person resembles wellness. You might be morbidly obese, but you're so much fun, you are so well. That's why I just felt so great. And then I just was like devastated when I went to Queensland Health in this project. Morbidly obese, what are you talking about? Western health, isolate due to disease. In the Māori Pacific perspective, it's we congregate. When someone's sick, everyone's up in that space. We're praying, we're eating, we're singing, we're doing the cultural massaging. We've got the leaves, the indigenous herbs, and we're drinking that. And that's our way of helping that person walk through their illness, which is not easy when you've got COVID, so that's not great. Western approach, medication, tests, x-rays. For the Pacific, it was natural herbs treatments. That's our way. Singing, individual private information versus it's everyone's business that you're not well, and we're all going to carry this together. Okay. The social, cultural, family factors. Food in a Western context has no spiritual value. Okay, we don't care. It's just, who cares, you got a sandwich. In the Pacific, especially with our elders and parents, it was very much about your best food. The abundance is your offering unto God. And from that, your families will be blessed. So there's a connection spiritually to the food. So that's why you touch, when God is so deeply ingrained in the space, and you, and one of the elders was saying, they tried to bring this in Tonga, and they talked to the churches, and the ministers were like, no way, we're not going to stop these feasts at our conferences, because that's the people bringing it to God. Let them bring it. The individual has to choose whether they're going to partake in that or not. If it doesn't help when the individual's being bombarded by everyone to say, that's why the social factors is also hard, because it's like, even that same elder who had, kidney disease, he said, I went to the conferences and I was like, I can't eat, it's do or die, it's death. And they're like, oh, okay. And then the social pressure to eat and join these tents, even though there were health tents they put up, and you try to go there, they'll just drag him along to where all the pigs and everything was. And then he ended up eating. So the social factor and the pressures that come with that, I mean, that's hard for the minister. How are the young people going to say no, especially the hierarchy ranking? It's not that easy. So there is a spiritual value to food. Food doesn't impact on the identity in the Western framework. There's no food here. It doesn't impact on ACPIR. In a cultural framework, your event without food, bro, this is a joke. Yeah. And that's what they would say. Like, I told them. Bridget did try to say, can we catch up for lunch afterwards? I'm like, yeah, afterwards. That's okay. That will still qualify your event. No, but that's what the elders and the parents like. Any gathering without food, that's a useless gathering. What's the point? What? So you can see even the mentality around the connection to food in terms of spiritual connection, belonging. It's a different world. Food doesn't carry cultural significance. And also to the point that food, your family will either rise or fall on your food. So every event, depending, like they could have the best $1 million wedding, but if the food was terrible, that wedding was shocking. And it's the talk of the town, and it's an embarrassment on your family. So that's like food carries an element of shame. And that's what a lot of the elders and parents are like. I said, why don't we have to bring pots and pots and pots? She's like, yeah, because it's shame if I turn up just with a plate. And they're like, oh, what, can't you afford? What's this little plate for? And it's like, well, you're trying to be bilingual. It's like, you're trying to be a white person. You don't have little plates. Where's the pots? The buckets, like KFC are onto it. They're providing buckets. That's what the perspective is. Food doesn't carry cultural significance. It does in our abundant food is our expression of love, respect, honouring. When I met with my elders to talk about this, I knew I had to bring cultural foods that just say, hey, I really honour you. Your tara, your corned beef, your KFC's kind of slipped in there as well. But I didn't turn up with KFC, raw fish, like there's a hierarchy to food. So even that's different in a Western framework, we kind of lobster, caviar, but not to the detriment of like how when I turn up with a pig, you're important. Yeah, like you mean business when I turn up with that stuff. So there's all of those cultural nuances with food. Even the portion sizes, like I shared, if you turn up with a plate, you're poor. Food doesn't define your value. It very much does. Shame. They talked a lot about shame. in providing little portions of food. Yeah, do you want to pause? You're up. Okay. No sharing due to health allergies. So that concept of, was there anyone got health allergies? Not in our framework. We had elders that would say, when I go back to the islands, I just get, I can't eat sugar because I'm diabetic, but when I go back, I know I'm just going to be drinking a lot of coffee with sugar in it. And they don't even ask you, like, would you like sugar? They just bring it to you with your coffee and sugar, and you partake in that. And then deal with the sugar issues afterwards. This was really interesting from the elders, the parents, and the young people. It was really important it's the funny side of humour and entertainment. So when I was asking for, I said, if you were going to change the situation for our communities, what would you do? And well, we wouldn't call it a health program. It would have fun. It would be dancing, our cultural dancing. You would need to include, if you see our people in the islands, it's dancing, singing, fun, entertainment. And they said, start with that, and then you indirectly, like it's a soft, approach in terms of bringing wellness into the space to have talks around. So it's less intrusive, and we can swallow it because we're laughing about our obesity, and we laugh, but we're really, so that's kind of how they suggested that we need to work in terms of this. Fijian elder, all our ancestors don't criticise you like here in Australia. Here in Oz, they whisper to you saying, you're too big, you should lose weight. I say, not in my culture, no. And that's probably why we haven't changed in the past 30, 40 years, because we haven't yet looked at how do we use the culture to begin to redeem our space and our wellness, because we weren't like this before, our ancestors. So culture is a key player. Does anyone have any comments, thoughts, questions?
I guess I have one. I'm just thinking, so say your ancestors many generations ago with the less diversity of food. I imagine, did that carry across from that level of food and nutrition to the caloric surplus of types of food now, which may be correlating with obesity? So back then you probably have more produce, fresh meats and things like that, but now you probably have the same cultural identity, but with foods which are more
highly processed. Yeah. Well, absolutely. One of the pastors, he was saying, the problem now with our people is that the appetite of abundance eating has continued, but now it's with highly processed foods. We eat like Samoans, but we're with the Western foods, which is not a great thing. So from that space, I've developed what I've called the Pacific Wellness Theory and Model. I was really intrigued because I wanted to know, okay, it's so overwhelming. I feel like, and this is why I started this journey, I know that my culture is a huge protective factor, but it's also a huge barrier. How are we going to change this? And so from the data, part of constructivist grounded theory, you have to develop a theory. So I had a look at, there were 17 cases where the elders, parents and young people talked about times where they made a change themselves, driven by, even the elders talked. There's one scenario where the elders were saying, our Bible studies, we meet every week, and rather than feast every week, we decided we're going to just have light supper. So I was like, oh my God, that's a miracle for the elders to change that, when the thinking is abundant eating and it's usually enforced by the elders. So I looked at all these different situations where it was driven, the change was driven by the people. And I developed the theory from there, which it's got 5 different components, because it has to be driven with them, by them. And the key for that particular situation was it just took 3 or 4 people within that collective cohort to say, no, we don't want to eat feasts. We are going to change our practice. So then, because those 3 or 4 people decided that's what they were going to do, and they were, the one that started it was one of the leaders. So even knowing who in the cultural framework, if you've got those people who are ready to make the change, that's where you want to build those partnerships with those who are the drivers of change in that group. And because of that, the whole group changed. So that's the power of the collective. It just takes a few champions that'll say, no, this is not what we're going to do anymore, to then shift everyone else. So that's my theory is based off these scenarios. I wanted to showcase this video clip, which looks at, because it was evident that the church is a prominent space, that really all these cultural practices of abundant eating is so prolific and prevalent. So the research was conducted with this particular church, and I wanted to showcase a video clip. They had, so they're actually doing this work now, and I've been involved in this space with them. I feel so much. So, but they were having issues with gestational diabetes, and our people, once again, not engaging with Western services. And that's another interesting thing with the theory, that of all the 17 cases, only 2 of them talked about external people coming in. They both failed each time. They didn't get the shift that we needed. But it doesn't mean that there's not a space for external providers. There definitely is. And I just want to show you Village Connect, which is an example of the church driving the change alongside external providers that are working to resource and also partner with the change to help them drive the change.
Right in the early days of listening to the community around what it was needed and what was culturally safe for the Māori Pacific Island community.
And we knew the Pacifica community is such a massive part of Logan, and I think it's true that about 1/4 of babies born this year in the city will be to a Pacifica family.
We came up to the hub with this idea that we wanted to build a maternity service for all of our Māori Pacific Islander population, and it was just sort of nutting out the details from there.
We've needed a hub for a very long time, and as I said, I'm just absolutely over the moon that finally we got that in the last sort of 2-3 years. It's been staggered over the different hubs that we've had, but to just get a hub here in this space, in this community, it's just something amazing.
The crew here at Village Connect, or was Hosanna Church then, only then, had a massive vision for what they wanted to achieve for the community. And they had this incredible culture of service to the community, and they were as passionate as we were about kids and families in this city.
We made the hub to be more comfortable for Pacific and Māori pregnant mums. When they come with their husbands. They are in a safe cultural environment.
I was really touched by the kindness, the openness, the humbleness, and the acceptance, that came from everyone being vulnerable about sharing their story.
I witnessed was not just one but a few Pacific Island mums losing their babies in the hospital and not being told why.
We didn't come home with a baby. We came home with a photo album and a memory of holding our baby, and then that was it.
The doctor said they couldn't do anything to save that baby. And we sat there and seeing that baby die. And it was hard for us to take.
Having birthed my second eldest daughter in the hospital system, I didn't feel like I was supported in many ways. So that's where the maternity hub offered something different, more to what I was used to back home. Feeling like you matter in a sense, you're not just a number.
Just being pregnant with my son, I didn't get a lot of the support that we are providing now here at the hub. Because I was in the mainstream system, I didn't get to, journey alongside midwives or community connectors. And so that's why my passion was to just help our other families, to see them flourish and grow.
Logan needs a strong Pacifica community-controlled organisation to do things for the local community. I'm absolutely convinced that the best people to do things for the Pacifica community in Logan are Pacifica people who know their culture, know their people, know the real life challenges that people face and know the answers.
So we've tended to try and use that the men's group as that base, so that we can draw out what we call mamae, or the issues and problems, for them to bring that out. Basically, was a need for men to feel like they're safe. They can come into a space where they can talk without that going outside these doors and talk about anything.
Another thing that breaks my heart is seeing people come here, families that are hungry, that will stand in line. It takes a lot to put the pride aside, to sign your name up. And I mean, we treat everyone the same. We don't judge, we love on people, but it takes a lot. And for families to come in that state is heartbreaking.
Parenthood or motherhood can also be very lonely at times, and yeah, it's also it's great to have a community that you can come to and seek help, and also just to rejuvenate sometimes, because in a home could be a very it could be a vicious cycle, but also a happy place. But we need to keep it a happy place, so we need these spaces to come and seek help and support from one another, because when we happy wife, happy life, right?
Like the mothers that come here are so grateful because they find the hospital environment very sterile. But when they come here, they get enveloped in the cultural love that we have as a Pacific and Māori people, and that is part of us. Like, that's what makes us who we are.
We look after women, we do caseload move-free, look after women from GP referral, which is usually that 12 to 16 weeks, all the way through their pregnancy. We are there for their births, and then we also see mums and babies at home in the family setting for about 6 weeks after.
And then we have our 3Gs, graciously growing in God. Their senior group is in every Tuesdays, and they go have some respite time, go and do bowling, and that's community-led.
It's a model that hasn't been done before. It works because it's driven by the people on the ground, for the people on the ground.
It's the right thing to do to support them to have a voice in front of those partners who don't really sometimes understand, the spirituality and the culture behind the fabric of the community, and how important that is, and how that needs to be represented in the things that, and in their service to community.
When I'm sitting in national meetings, I mention the maternity hub because it is one of the first actually in Australia for Pacific communities. So we're so very blessed to be part of this.
It's not a top-down kind of model, external organisations trying to come and work on the people. It's the people driving the change, and that's the most important part, is people are driving the people that it impacts are the ones pioneering the change.
A mother comes for a $50 voucher for shopping. We have the means to give her that. That's what gets me up. Like, it may not sound great in the secular world, but to me, this is the $1 million job.
Village Connect will be the identified Pacifica organisation that will drive change within our community.
Welcome to your Village Connect. This is your village where you get to have a say how you're going to be serviced, what you want and how you want it, and who you want as your support person, because once you come into Village Connect, you never journey alone.
It's all about you being at centre, and these wraparound services being the safe place for you to be able to be wrapped around and nurtured and loved and encouraged and empowered.
That's been amazing, and that's a huge company of people on the ground in that space, working alongside with stakeholders and giving voice to the people that they're trying to work with. So that's a bit of a sample of what's working on the ground now. Having said that, there's lots of challenges in terms of resourcing, not having enough resource and working that space. But I think what's important is that the community is working together to raise the issues and bring the changes collaboratively, collectively. What does this mean for us in terms of the research? Health Western ways versus holistic wellness Pacific ways, two different worlds. And what I love seeing that's starting to happen at Village Connect is we're trying to find how do we marry the spaces and the understandings together. And I've seen it very beneficial for the church in terms of upskilling the people in the house, and vice versa, upskilling the stakeholders that we're working from that are Queensland Health and their Western understandings. So it's an upskilling on both sides, and finding ways to marry. And it's still a work. That looks beautiful. We didn't show all the ugly stuff that happens. It's certainly there. That's the filtered version, but that's all part of the journey, isn't it? Especially when two worlds are colliding and we're trying to find a way together, because we ultimately all want the best for our communities. Both, doesn't matter which world you're working in, and that's why it takes a bit of a journey of understanding. The need for recognition and acceptance of the spiritual and cultural practices and medicines. So that's been really important with, in some of the reports that have come back at times when they ran the gestational diabetes program with the mothers, it came very strongly from a Western, so they had lots of terms and boring, like remember the fun and entertaining. So whereas some of the feedback was good start, the health funded for Pacific communities, they've got Pacific people working and they tailor it. So they understand that, we don't want to throw and drown them in terminology, but if you can have some fun and keep it activity based to bring at least 2 or 3 key learnings, that's a great starting point to begin to bring the understanding and knowledge. Incorporating fun and humour, the need for cultural and generational tailoring. So it's not just cultural tailoring. The elders have got their own understanding, the parents, and then your young people, like the young people were very much, they 50% were more strongly influenced by Western ways and were familiar with that, and then 50% was more very ingrained with Pacific. But there was more of an openness in terms of, like they were the first. It was interesting when I interviewed the young people, when I said, tell me about your culture, first things they said was fatty foods, fat people. So and they talked about these particular things first before our cultural values like respect, service. So that was like, wow, that's disturbed. Like, wow, what is that? And then some of it was like, I'm a plastic islander, I don't even understand. I just do it's all part of the collective, whatever the collective's doing, I'm doing it. Cultural programs addressing holistic wellness as a key way of working, not just on my body. And that's collective action towards change. So that's all I have for today. And any comments or questions on my doctoral journey?
I already did it. Well, thank you, Inez. That really was such an interesting and really impressive presentation today. And I know, I'm speaking for myself, but I think I'm speaking for everyone that we need to thank you because we've learned so much just from having you here today with us and all of this really important information that you've shared with us. So thank you, really mean that. And thank you for sharing that video as well. It's quite a moving video and wonderful to see all that work that's going on with that maternity hub in Logan. And some really strong messages there that it's the people driving change and that's what needs to happen. So yes, we see that. That's really important. Thank you. We are going to open up for questions now. The first question was from Anali, and they've asked, are there plans for future hubs being erected throughout regional and North Queensland?
I think that would definitely be a great, there's already hubs, I think there's 8 different hubs. They're not all Pacific Island hubs, but I think that would ultimately be a great way of working. We're literally just giving birth to the model, and so I think hopefully yes, but money talks and resourcing talks and getting the communities on board is a real key element to it. So yeah, but hopefully yes, absolutely would love to.
Yeah, the goal would be to have it all over Australia, wouldn't it?
Yes, once we can.
Pacifica communities.
That's right. Find the key players both in the community and services, and bring them together to work out how to. I always grew up just thinking there's just such a clash of two worlds, always clash of two worlds. But in this space, I feel like these two worlds are beginning to collide sometimes, but navigate together.
I suppose what I'm kind of thinking is the idea of sort of Western individual health coming into the Pacific space, but also the idea of holistic health towards patients. I think the Western needs to take a learning note from that and apply it to their system as well, because I think even if you're not Pacific, if you go into a hospital, especially if you're going through something like pregnancy, it is a very clinical process from what I've heard, and it is making people feel alienated or disengaged from seeking medical help.
Yes.
Yeah, so I think you could learn from kind of both worlds and integrate it both ways.
Absolutely. I totally agree. And that's why I was like, when I was looking at that video clip, you can see Muslim women in there as well. I'm like, this is what, it's just a safe space for all where we can go and learn and ultimately improve our wellness. That means a lot of help.
Our well-being.
Yeah.
We can be happier people.
Yeah. Well, the thing is, even the term wellness, because when I asked the elders, what is the word that you would use for health in your, and so all the cultural terms they gave me, the most familiar word was wellness, because I was like well-being, but when I took their cultural term and I said, what does that mean? It's like, well, it's well, we are well. So I was like, okay, well, I will use your term so that we can engage with what we're doing.
Body, mind, and spirit.
Yeah, holistic. Everything is balanced. Oh, that sounds like a nice space. It feels like the Sunshine Coast.
We need more of it. And there is a comment in the chat from CA. It's quite a large comment, so I haven't read it out yet. So hopefully I read it properly. But just a comment leaning towards earlier Pacific diet, where Pacific people ate directly from the land. Earlier reports from Westerners' experience in the Pacific referred to Pacific Islanders as lean and chiseled individuals. In Samoa, the general belief is that food and health was not really a problem until we started getting a lot of processed and tinned food from overseas, initially in response to natural disasters such as Category 5 tropical cyclones. I'd love to see how your study can unravel how your elders and culture can amend, teach, and form our people's eating habits and lifestyle choices for healthier Pacific communities. So not so much a question there, but just I thought a comment that was worth to read out to you.
And that's why I looked at the theory that looked at these different cases that were, especially the key players that gave me scenarios were the parents. So that in itself, like, okay, because the young people, hierarchically, do they have a voice? No, not culturally. You don't have, when we step to culture, the young people don't have a voice because their role is different. They just follow instructions and they're growing in their knowledge of how we do things. But the parents were the key players in terms of driving change. And with the theory I looked at, so collective individual agency. It's not just when the individuals try to work by themselves, it fell over. But you needed a collective agency, collective individual. I said both because sometimes in the cases it took a few people, just like I said, the elders group, it was just 3 or 4 to make that shift. So the collective individual agency, then there was a collective agreement, we're going to do this, because when you're going up against a Goliath of culture, you need to be in agreement with what the plan is. And then the collective action is, okay, we're going to roll out together. Everyone, we're on board. Even if the elders are angry with us, we're still going to keep pushing the change. So collective action is getting all the key players. Commitment to change was a key play. Like, because I can't explain enough how hard it is to go against cultural protocols. And that's why the commitment to change has to be really, and that's what one of the elders was talking about, like we got backlash from the elders when we decided we were going to have small punnets of food for our 10th anniversary, not feasts, and they were not happy. So, and that Western was like, oh, elders don't care, elders are angry, who cares? But, in our cultural framework, to have the elders angry at you, that's like shame, that's like, like you're a disgrace to our space, like our people. So that's why your commitment has to be solid with your little collective agencies, like to be able to keep, and then that commitment can then bring the cultural shift that is needed. So the Bible study change. That's the theory of what I've kind of gathered from looking at these case studies from the research.
It's interesting, and as listening to you, it seems that religion is such an important part of this collective movement of bringing about that change.
Yeah,
it's a strong message, I think.
Yes, and there have been studies that I've looked at where the church. I think in my literature review, I've been trying to find models where the church is part of the, because that's where everyone's connecting into now, But a lot of the interventions were just, we're going to run an 8-week program in the church, and then they leave, and so does your learnings, and so does your knowledge. Even the elders were talking about, we had this guy from the public health system, and he came and he was telling us about how we should eat, and we were all laughing, and then we had a feast afterwards, and then there was pig. So they honour you. There was pig, and we did get salads, but when we looked at everyone's plate afterwards, they'd just eaten the pigs and the salad was just for show. So if you're looking for sustainable change, it's more the model that we're seeing happen at Village Connect and working in the church space with stakeholders, because they'll keep driving it. But yes, those partnerships are key, that collective agency.
A question from Chris: can you compare this model to the Onehour, or I'll pronounce that wrong, model used by the healthcare providers in Aotearoa?
I actually haven't really looked at that one. The one that I've used is the Whānawhāle model, and I understand the model. I think the challenge is in terms of how do they incorporate. What I've been trying to find is how do they incorporate spirituality in the servicing. So I have found some research papers that have, what they've done in their spaces, and it hasn't been in churches, it's been in an organisation where they have cultural healers alongside psychologists and counsellors. So there was a case in one of the literature that I found where the Cook Island mum was bringing her daughter, and she knew it was a cultural issue. The daughter kept, having this major outburst for months and had superhuman strength. She got the assessment done by the psychologist from this service, and that psychologist was like, there's no diagnosis here. So then they incorporated the cultural healer, and one session with the cultural healer, pretty much they didn't have any other problems after that. And what happened in that session is, and in the research paper, the cultural healer talks about what happened, the psychologist talks about what happened, and the mother talks about what happened. And the cultural healer, as he brought the mother and the father in with the child, he sent the child to go play, and he said, I see, he said, there's a spirit, he asked the mother, what is your relationship with the grandmother? The grandmother's obviously passed on, and the mother said the little girl was raised by the grandmother, and she said, and he said to her, I sense that the grandmother and there's an elderly man here, they're not happy with, because they were going through a divorce, the mother and father, and it was very toxic. So the cultural healer was saying they're here because they're saying if you do not fix what is happening in this space, the elderly lady will come and take your daughter. And so at that session, she had to ask forgiveness, he had to ask forgiveness, they reconciled, and then there was no longer any issues with the daughter. So that whole thing of marrying together, that's what I'm looking for in terms of the Whānawhāle model. How yes, it's good to have the model, but how can I see it played out, especially in terms of spiritual healing? And where does that sit in our service deliveries? I could only find 2 cases.
So Tara would like to ask a question.
Yes, sure. Hi, Tara.
Hi.
Hi.
Hi, Inez. Hi. It's kind of more of a comment. I remember seeing you present at a Pacifica Day at Griffith University in Brisbane. It was probably a couple of years ago now, definitely before COVID times. So, and I just want to say, yeah, that's something that we definitely think about when we are working in the Pacific. It's always probably the first thing we think about is how are we going to get the food, where are we going to get the food, who's going to organise it, you know, and kava often too. So, and the difference, you know, in those times when you don't have the food and you do, I can definitely see, you know, and we do try and get the traditional foods. So yeah, I'm really happy to watch you talk today. It's always nice to see you present. And your work at Village Connect is really touching. I'd love to come down and visit, and I think I'm going to plan a trip down there because I even think in a Western culture, something like that is, it's really inspiring. But I'm wondering, are you doing any further research, like from your work? Back in your...
Sorry. Did that come out? Yeah. I actually say that out loud.
Well, I know that you do your day-to-day work, but are you actually, you know, are you collecting data? Are you looking more into, you know, like this connection between the elders? And obviously, because cultural change is, you know, probably one of the hardest things you can change, and whether you even want to call it change, it's probably just going back to the grassroots of, you know, steering away from those imported products, which is a lot of the work that we try and do. And I think, yeah, that's kind of at the crux of it, because, yeah, like CA said, you know, when we think of, you know, pre-colonialism and the Pacific Islands, yeah, everyone's running around, yeah, they're chiseled, and, you know, so to have that, yeah, now you've got the same, you know, behavioural eating habits, but it's the different types of foods.
Yeah. In terms of your question around further research, I think there's definitely a need for it, especially with the work. And I do want to put a disclaimer, like, I'm not on the ground in Village Connect. I am involved on the board and working in that space, and that is my space. But yeah, they are. I think if more research could be done to be able to collect the data on the work that's being done. We're literally in the labour room still giving birth, but it's definitely needed. And even, you know, my input on when we get the reports on the board, and I'm always saying to them, because some of the challenges, you know, they talk about that, you know, that the mothers didn't like the diabetes, the gestational diabetes program, and it's also just reinforcing the workers on the ground that yes, you're working with the professionals, but you need to be able to speak and know that your ways, the ways that you know that's going to register with these mothers, you must speak up, because that's just as important as all the knowledge that Missy Moo has. Like, you've got to try and, like, don't be afraid to speak up and say, hey, that's not going to work. You're just going to bore them to death and they won't engage. And there has been times where they haven't engaged, and we've had to park the project and try and adjust that again when we're working side by side with our Queensland House stakeholders. The two different.
Thank you.
Hi, Dion.
Yeah, Dion would like to make a comment as well.
Yes, and depending on how bad that comment is, will depend on what Dion's my brother from another mother, so.
Hi, Dion.
But I just must have a disclaimer. This is my PhD sister here. She's the one that helped me go through the PhD journey, so it's so awesome. This is the first time I've seen her present, and it was a whole lot of fun. But I'm currently a lecturer at AUT in this Faculty of Environmental and Health Science. And just what I'm seeing, you know, one of the guys in the video said it best. The best people to champion the change in the Pacific communities are the Pacific people themselves. And I just have to make this point very, very clear. Everything to do about us should be done with us from the very beginning. And that doesn't mean you have your little framework and then you go and consult and then you go and get a Pacific nurse. No. It means it's all done with us from the very beginning. And having moved to New Zealand for the last 3 months, New Zealand does it quite well.
Yeah.
And any of the any meaningful changes in terms, in terms of our health, it must be done from the very beginning. And I also have to say as well, we have qualified people now within the Pacific communities to do this. We have Pacific professors, we have Pacific medical doctors. So I just ask, everyone here in terms of going forward and anything to do with Pacific, that you guys really engage on our experts that are already very much attuned to the cultural nuances and the cultural knowledges and the mana that comes with our traditional knowledge systems, but also are schooled in the Western system as well, because from there, that's where the real change comes. I've seen far too many Pacific Island initiatives, not only in the diaspora, but in the islands as well, that have really been patronizing and tokenistic, and they don't work. They don't last very long. The era of Margaret meeting and talking over us and coloring us and white-splaining us has to end. Only by doing that will the real change occur. And yeah, that's my 2 cents that I'll just add in there for today. Thank you.
Love it. Yes.
Thank you so much for sharing that as well, Dion. Your 2 cents are very well heard and respected, so thank you. Did anyone else have any other questions for Inez?
Just want to resonate what was just said there before. The Pacific does help. We need to help the Pacific. It just sometimes needs the tools and the resources to do that. And that's the only time you're going to get real change.
Yeah.
You've forgotten that. And I think much of what Australia and Western society has tried to do is make the Pacific like the West and not necessarily value what the Pacific has to teach us. And that trying to change the Pacific to what we think is what it should look like has been the recipe of all the problems.
Yes. I love what Dion was saying in terms of having Pacific involved, and it's not just the professionals as well, because we do have our professionals in that space, but our elders, our parents, those that are on the ground, and that's their space. They will know who are the key players in that community that you also need to engage in. Once they're on board, you will be able to have driving the change a lot easier. And it's also hearing from them in terms of what's going to work for the community in terms of bringing wellness, holistic wellness, which we all want. So, yeah.
Can I just say one last thing? I know this is all about health. I know it's all about health. Wellness, health. But culturally, I can't let you go without giving you a gift, and I have to give you food. And I have to give you what you would know as. And that's from the centre.
It's all about wellness here. This is what we talk about. Instead of the whole tray, I'll just have one.
And inside that. But anyone that's made the effort to come, especially up here, just to speak to us, I think deserves incredible recognition. I'm so appreciative of your time.
Thank you so much. I'm really honoured to be in this space, and no doubt, hopefully, you will continue the journey as I get to know what you're doing and how we all can work together to improve outcomes for our communities. I think that's the heart, really, of why we're doing all of this. We don't get paid enough otherwise, do we? That's true.
Thank you. Well, thank you, Inez. I think that on that note, we will finish the seminar. Sorry to everyone online who doesn't get to have lunch with Inez after this, but I will be. But thanks everyone for joining in today. Thank you, Inez. And we'll chat with you all again soon.
Yes, thanks everyone.
Thank you.